Now let's talk about ischemic strokes and the major points you need to know. Ischemia means low blood flow or low oxygen. Ischemic strokes are caused by a blood clot that blocks vessels within the brain. When that happens, there is no blood flow past that clot, which causes the brain tissue to die. So a blood clot forms in the brain, no blood flow past that point, and then all of our tissue down here begins to die. So this is like having a rock inside your garden hose. You can't water your flowers that way. It only takes about 10 minutes without blood flow for brain tissue to die completely. So you can see how emergent this situation can be. Ischemic strokes represent 87% of all strokes in the US. So when a patient presents to the emergency room with a stroke, one of the first things we do is we get a CT scan. Now, ischemic strokes may not be seen right away on a CT scan, so they begin to show up after about 6 hours or so and are obvious on a CT scan within 24 hours. So you can see the scan right here, this darker area here showing that this tissue has no blood flow and that it's starting to die. This is a huge stroke here. You see how big this is. Now, if we suspect damage but can't see detail on a CT scan, we can get an MRI for better image. When a patient presents with the signs of a stroke, one of the first things we do is we get a CT scan. Now, we also check blood sugars, and we do just a thorough neuro assessment to make sure that it's not something else. It's not like diabetic coma, or they're not acting weird because of some other neurological issue. Since we can't see this scan, we assume stroke. And then we follow up with CT scans as we go, as this starts to appear later on. Now, hopefully that MRI will give us a better view, but if it doesn't, we aren't going to be able to see this for 24 hours. We obviously don't have that much time to treat, so we take our blood sugar, realize it's not, and we start treating stroke. Common risk factors for stroke are hypertension, diabetes, obesity, and atherosclerosis. Now, what do these disorders all have in common? They're all vascular issues, or they cause vascular damage. Now, just like we talked about in the cardiac lesson, any damage to the vessels can cause plaque to build up and clots to form, just like it's doing in this picture here. This could be a cardiac vessel, or this could be a neuro vessel. Patients with cardiac dysrhythmias like atrial fibrillation are also at risk for clots, as well as women taking oral contraceptives and people who abuse illicit drugs like cocaine. Now, these clots can form in the brain, or they could form somewhere else and travel to the brain. That's why it's such a concern when a patient has like AFib. We really want to prevent any clots from forming and any clots from traveling up to the brain. Now, we're going to talk about this in a little bit more detail when we get to the assessment lesson, but we want you to be aware that the specific presentation is going to be different for every patient depending on where the clot actually forms with this patient. Now, we have a great cheat sheet on this, so make sure you check it out. But this structure here is called the circle of Willis. It's the main structure feeding all the arteries of the brain. If we get a clot somewhere in this circle, you're going to lose a significant amount of blood flow. What you see here is as if there were a clot in the middle cerebral artery. You can see on the patient's left side that it's getting a little hazy and a little darker and a little bit less defined. You can see this tissue over here doesn't appear as defined as the patient's right side over here, right? It's just the opposite on a stroke. This is their left side, this is their right side. Now, this shows the beginning of a left MCA, middle cerebral artery stroke. The CT scan we saw on the first slide was actually a very, very, very severe right MCA stroke where it was eating up like that whole right side of the brain. So you can see how if it goes on for very much longer, it can cause more and more and more damage. We'll look in the therapeutic management lesson about what we do and how we try to stop it, but you can see how important it is to get started immediately with treatment. So remember, an ischemic stroke is a lack of blood flow to the brain caused by a blood clot in the cerebral vessels. The risk factors for stroke are anything that affect the integrity of the vessels or causes blood clots anywhere in the body. hypertension, DM, CAD, etc. The specific symptoms and presentation will depend entirely on where. So, just like in real estate, it's all about location, location, location. And that means everything to a stroke patient. So, make sure you check out the cheat sheet and the assessment lesson to learn a little bit more about that. All right, so those are the basics of ischemic stroke. Now, make sure you check out the rest of this module to learn more. I really want you to do the care plans and look at all the cheat sheets and everything because at the end of the day, we want you to be the best nurses you can be, advocating for your patients and making sure they get the care they need. All right, guys, now go out and be your best self today. Happy nursing.